there was like 3 check-in points that the doctor missed, and the patient ended up bleeding to death.
So what differentiates, what you're doing versus what a paralegal can do?
So a paralegal will review the documents that they have, but they may not necessarily know what they're missing, what documents are missing, also what like the protocols are for like nursing protocols, for example, as well as all of the terminology and how everything connects together. So whereas we can go through and like medications, for example, like I was telling you that previous example, so we can look at a medication list and be like, okay, why did they give those two medications together? That's what contributed to the respiratory distress. And whereas they might miss that because they don't know, unless you know, research every single medication, which that can be time consuming, where it would take us, very little time to look at that and say, oh, that's an issue. So we can point out things a lot faster because we have the background, the medical background, and the experience as well. So especially to know things that maybe are not in a book, like nurses, the way we do things. Oh, well, that makes sense that they did that or whatever. So because we've experienced that before.
So without naming names, tell me about a case where something you found in the medical records completely can change the direction of the attorney's strategy.
So with, I would say there was a competency case where they were struggling to show that there was a parent that signed over property to a granddaughter. The daughter of the older or the patient was claiming that she signed over property and she was not competent. So they had reviewed the documentation, but they were trying to prove like how can we prove that she was not competent? And so I just went through the admission documentation and just the fact that the granddaughter signed as medical power of attorney. I was like, okay, well, that shows right there that she was not competent because in order for her to be signing as medical power of attorney, she's saying that the patient is not capable of making decisions on their own. And so it was something simple like that I was able to show, and then they ended up winning the case. And the daughter got the property that she was entitled to.
So that I could see how that would flip the whole thing. Can you tell me another individual's situation where something you discovered changed the outcome?
Sure. We had it was a wrongful death case, and it was kind of an extensive one because the attorney reached out. She needed, so the patient or the client, his wife was pregnant. She went to her OB appointment, and the baby, they didn't find a heartbeat. So they said, you know what, we're gonna have you go to the hospital, deliver the stillborn. So she went to the hospital, delivered the stillborn, and shortly after, there were some indications that she was bleeding that were missed. There was like 3 check-in points that the doctor missed, and the patient ended up bleeding to death. And so the husband was left with 3 other children. So I needed a labor and delivery nurse to review that case. So I had one of my nurses review it. She determined that there was missing records. So that's where the autopsy report came in, where it was only a partial report. So let the attorney know, hey, we need the full autopsy report. We need all these other specialty records as well. Once they got the records in, then she was able to determine, like, we missed like these 3 check-in points where the doctor could have determined, like, hey, she's bleeding, I need to intervene, and she didn't. And so then she also needed an expert, another OBGYN, to review the case and write an expert report on it. So I had to find an expert. So I found her 3 doctors, and then she ended up choosing one of them. And that doctor was able to complete that report and show that there was negligence on the doctor's side. But again, that autopsy report was only partial, so it stopped at the lungs, definitely not any of the reproductive organs. which is what we needed. And so that was kind of a game changer because then the attorney probably didn't know that that was not the full, or maybe hadn't caught that that was, they hadn't given her the full autopsy report.